as a medical doctor, I don't believe that somatoform disorders are.
Hey, I'm Dr. Dooley. I'm a board certified psychiatrist, and I'm here to respectfully disagree with the idea that somatoform disorders aren't real. And part of the reason I want to do that is because there is such stigma around mental health conditions, and the thought that these conditions are either less than or again not real compared to other quote unquote physical health conditions. And particularly as it relates to somatoform disorders, they can be particularly disabling. And so I think to dismiss them as not real really misses an opportunity to help someone, live their most productive life and get the treatment that they need. So I think most people can relate to the idea that, let's say you had to give up and give a performance or a speech, right? Performance anxiety, that being anxious or nervous in your thoughts about something can make you have a physical reaction, right? The whole idea of butterflies in the stomach, people can relate to that. So and I think at a very kind of visceral level, the idea that your mental state can affect your physical well-being, a lot of people understand that connection. And there's multiple somatoform disorders, but I'm going to talk about a couple I think people may have some familiarity with. So body dysmorphic disorder is a somatoform disorder, and particularly for people who have certain eating disorders also, they often can have a body dysmorphic disorder. They don't have to have an eating disorder, but you'll find that commonly. So like in the case of someone with anorexia, they may really look in a mirror and perceive the way their body looks in a way that's just not real. There's cases of people who, go for multiple surgeries, like plastic surgeries, because they feel like their nose or cheeks or something is off. It's like they do not have an accurate perception of what they really look like. And again, this can be particularly disabling to people when that happens. It can really contribute to those other conditions or getting a lot of procedures that you maybe that you don't need, but that can have a high risk, to you because you just feel like you have to get something perfect. Other people, you may have heard of conversion disorder. So conversion disorder occurs when you physically have the symptoms of a condition, but there's no evidence that you have that underlying condition. And I know in my history, I would treat, when I was, let's say a resident, I was on a neurology service and I worked in the seizure clinic. And there are people there, and a lot of these people actually do have a diagnosed seizure disorder. And then they also have what we call them pseudo seizures. And so they have activity that looks oftentimes just like the true seizures that they have, but it's not there. And how do we know it's not there? Because when we have a concern about this as psychiatrists or other medical professionals, we would put a patient in a hospital hooked up to a video EEG where you're videotaping them, you're videotaping their brain activity. And what will happen is that people will have, often tonic-clonic, like physical, that kind of physical seizure symptom. But when you check the EEG, that brain activity is not there. And why I think it can be so harmful to dismiss this and just say, oh, that's not real, is because for the people who are having the pseudo seizures, the seizures that, the physical activity that's happening but is not associated with any brain activity, that to them is very real. It can be very disabling. Like there are people who have had accidents driving from having pseudo seizures. So even though there's no, the EEG is not detecting, brain activity consistent with a seizure, that physical activity can still cause a harm and still needs a treatment. But we know that when there's no abnormal brain activity, medication is not going to treat that pseudo seizure. We have to get to, the core of why a person is engaging in that behavior. What is that doing for them? I've seen people who come in and present as if they can't walk, and they have every kind of physical therapy, OT, MRIs, LPs, lumbar punctures to try to figure it out. And it turns out that there's no physical functional reason why they can't walk, and they are capable of walking. And oftentimes on exam, you'll see things like, for example, people who say, they can't walk, but because they have no functioning in their lower limbs, but they can move parts of their limbs. So there's ways of detecting as it relates to certain conditions if there is a conversion disorder there. And like I said, just because there's no underlying physical thing that's causing some of these conditions, it doesn't mean that it's not disabling and that people don't need treatment. I totally understand how often people with mental health disorders are dismissed, particularly because, again, I think of that stigma. I mean, as a woman, as you know, a Black woman, I personally have experienced in the medical system having my complaints dismissed in a way that had a significant impact on my health. So I can definitely relate to it. So I think that everyone who's presenting with a symptom definitely needs to be worked up, and let's be sure there's no underlying medical reason. There are going to be things in medicine that we don't know, or we don't have the tools to detect, or we don't understand. Totally get that also. But I don't want to dismiss the impact that mental state has on, you know, heart health. We know that stress impacts that. We know that anxiety can contribute often to people have worsening of IBS. That's a condition I would see oftentimes together. And when the mental state is there, it literally causes the physical changes that happen, right? Our body responds to stress and causes physical things to happen that can worsen an underlying medical condition. So I just wanted to come to say that I don't, I definitely feel that everyone should be listened to and their complaints thoroughly worked up, but I don't think we have to dismiss the mental health component while we do that.